Hello, friends. It's Kimberly here, Vice President of Clinical Services here at Specialty Care Management.
Hi, my name is Stephanie. I'm a registered nurse here at Specialty Care Management. I just love, being able to help and assist patients and educate them in a profound way.
I realized that I really like working with people, and then I like medicine, and I felt like nursing would be a good way of balancing both without going into a 12-year,
Medical school.
Yeah.
Yeah.
I was actually born in Argentina. Not a lot of people know that. And we came to America when I was 4 years old. I won't say the year. My parents were coming here to live the American dream. They came with very little in their pockets, and they were able to be really, really successful here, not only with what they were doing, but being successful people who really showed how life was supposed to be lived. But they've had just an amazing impact. I mean, I am who I am because of that.
I feel very honored. I've been a nurse for many years and had always wanted to be a nurse as a little girl growing up in a house full of nurses, a family full of nurses.
So what I love most is just having the knowledge to be able to educate, patients about, their health, about what they can do each and every day to better their health.
I just feel like I am such a useful tool. Typically, we work with patients in the health preventative and trying to focus mostly on their kidneys and how to prevent any kidney disease and things like that. That also goes in hand with a lot of things that drive kidney disease, such as diabetes, blood pressure, and cholesterol issues. So I just love how things go hand in hand and how we can just ultimately help a patient by assisting them with real-time problems that they're having in their life.
When you go to the doctor's office, there's, like you said, you only have 5 minutes with the doctor. You have a little bit more with the nurse, but when you're there, unless you bring a piece of paper with all the questions that you want to ask, it's like this.
Yeah.
So, I'm able to bring that sort of relaxed environment to the members and just sort of educate them and have them ask me questions that they have. They're able to call me, they're able to text me, any questions that they may have.
We are patient focused, but in that patient focus, we're also targeting these groups by assisting them with their employee health plan, helping a patient revert diabetes, losing weight, and all these things that can potentially lead to a lot of issues, especially if you're already at the brink of CKD, chronic kidney disease. This could lead you to a dialysis chair. Not potentially, it's not if they're going to happen, it's more of when it's going to happen.
I feel that my job is very impactful on people's lives, and I appreciate that. That I could just, with a call and a conversation, I can change someone's life.
Just the way that this program works, I think it's very personal to the members. And like you said, when you're at the hospital and you have like those few minutes to be able to teach, a patient, it's great, but there's so much going on at that bedside.
Yep.
That, they hear you, but their retention is a lot of times not there. So being in this relaxed environment that we're in, when I make my phone calls to my members, they're really able to listen and understand and, take away exactly what I'm trying to teach them. They're able to better their health, which means that down the road, they probably won't have chronic kidney disease.
But when people decide to take care of themselves and they have that aha moment, it feels good.
Yeah.
Plus, I feel like I'm helping in even just one person. Like, I'm not trying to change society or the planet. Just one person that, takes better care of themselves and can play with their kids or their grandkids or whatever. I really appreciate that.
Absolutely.
So we're teaching these members that if they take care of themselves now, they're that much less we could avoid certain things in the future.
It impacts everything. It's huge. It's a small piece that impacts the ripple effect. So the insurance is going to be cheaper, or at least it's not going to get more expensive. They see their doctor more frequently, ideally, or they take care of themselves, so they're not spending that much money on, for the health plan and for them. Plus, personally, they go to work because they feel good. They're not missing work. And then they can spend time with their family and they feel better.
Yeah. Sometimes it's what we don't see that's where the impact really is. We just don't get a chance to see it. And that's the goal, right? Is not to see things like kidney disease or dialysis for sure.